Hi everyone, I want to talk to you today about assessment. Now, assessment is the most important step of the nursing process in a lot of ways, because it will determine the direction of the nursing care. This is where we use our detective skills to gather our clues. You have to remember, the treatment can only ever be as good as the assessment, so high quality assessment means high quality treatment. For this reason, each semester of nursing school puts a huge emphasis on developing assessment skills. Semester 1 usually focuses on fundamental skills and learning to recognize what's normal in a patient. Let's start with some major principles of assessment. First of all, it's important to note that when we are gathering information, it's usually categorized into one of two ways, either subjective data or objective data. The subjective data is what we get from the patients by asking them. It's what they tell us. So it's the symptoms of pain or the reports of emotional struggles. It's information we can only ever get from asking the patient and hearing their personal report. Objective data, on the other hand, is information we can gather from our own assessments, from our own senses, from looking at the patient. It's things that we don't necessarily need the patient to report in order for us to understand. One way nurses assess objective data is by taking vital signs. So, when you go to the doctor's office and you sit down in the chair and the nurse puts a blood pressure cuff on you. Well, she doesn't ask you what you think or what you feel your blood pressure is. No, she puts a cuff on and she measures it herself. That's because vital signs are objective data. Vital signs are used to determine the physiological stability of your patient. This includes measuring the blood pressure, the heart rate, the respiratory rate, the pulse oximetry, and the temperature. In addition to vital signs, nurses gather objective data by utilizing the following assessment skills: inspection, palpation, percussion, and auscultation. The first step is inspection. This is when we gather our visual clues. This might include looking at their color or paying attention to the fine details. Is the patient flushed or are they pale, etc. The next step, palpation, is when we use our hands to determine the physical characteristics of the area we are assessing. This could include feeling for firmness or unusual textures. The third step is percussion. This is basically just tapping over an area of the body and listening for how the sound bounces back. We do this to determine the density of the underlying tissue. We'll see that the sound changes over dense areas of our body, such as bone, versus areas with soft tissue, such as our abdominal region. The last step, auscultation, is just really a fancy word for listening with our stethoscope. We could use our stethoscope to listen over lungs, or to heart sounds, or even to bowel sounds. Now, these are just the basic definitions of these terms, but we want you to know what key terms to start looking for when you're studying. Okay, let's move on to a key principle that is important to remember when conducting an assessment. That is being systematic. Being systematic in your assessment is very important to gathering effective data. You don't want to be jumping all over the place when you're doing an assessment. You don't want to be in the middle of, say, listening to lung sounds and then jump to testing reflexes. You want to keep it in order. This method is less work for the patient and more efficient and effective for you. The most famous and probably widely used example of a systematic assessment is moving from the head to the toe. That means beginning with a neurological assessment and working through each part of the body systems until reaching the extremities. When we do this, we basically work through each system and use our assessment skills. We inspect, we palpate, we percuss, and we auscultate in each system in a systematic way, moving from head to toe. Now, when we reach the GI, the gastrointestinal, or your abdominal assessment, the order of inspect, palpate, percuss, and auscultate changes. Here, we switch the order to inspect, auscultate, and then percuss and palpate. Because by palpation and percussion, we change the vowel sounds, which is going to alter the quality of our auscultation. If we're moving around someone's stomach a lot, it's going to increase their bowel sounds, which is going to give us an inaccurate assessment. Another essential principle is remembering to always be respectful while conducting an assessment. Patients may feel very vulnerable about having another person examine them so closely, so it is very important to include them in the process. Talk them through what you're doing, explain things to them, and be careful about closing the curtain and covering them back up after the assessment. Being respectful is not just a major principle in daily life, it also often shows up in test questions. The nursing board has to make sure that we understand that we cannot be effective nurses if we are not being respectful nurses. In the beginning of nursing school, the assessments students are required to do are often very extensive. I remember when I first got to nursing school, they had us filling out a 16-page assessment tool. The assessment was very extensive and required us to go into a lot of details with our patients about all areas of their medical history. Although this might seem daunting at first, it has a purpose, so we have to take it seriously. The purpose of giving new nursing students such long assessments is to develop our skills, and so that we get familiar with the objective and subjective data we need to gather from our patients in order to make an effective plan of care. Slowly, you'll shift and learn more about a focus assessment, but that's for a later time. In all cases, it's important to have strong assessment skills and head-to-toe assessments, and this will give you the most accurate baseline to build a plan of care.